You've just taken a mace to the head. It's 750 AD. Your skull is fractured, and you need surgery immediately. Popular assumptions about this era suggest your next few hours involve a filthy room, a primitive butcher, and almost certain death. Early European medicine was a gritty, crowded business. In many towns, the barber who cut your hair was the same person assigned to drill into your skull. However, recent archaeological finds and translated manuscripts suggest this barbaric stereotype is inaccurate. Surviving a major operation in the Middle Ages was the result of a sophisticated, interconnected medical system that built the foundation for the modern hospital. To address the agony of the procedure, surgeons used the spongia somnifera, or sleep sponge. This served as the medieval version of general anesthesia. Physicians created a potent liquid by soaking sponges in extracts from the Solanaceae family, a group of plants including mandrake, opium, and henbane that contain powerful natural sedatives. The practitioner reconstituted a dried sponge with water and held it over the patient's nostrils. The inhaled chemicals entered the respiratory system and blocked pain receptors in the brain, inducing a state of deep unconsciousness. This calculated, chemically sound practice provided a reliable blueprint for the development of modern anesthesiology. While local European tradesmen handled basic injuries, elite scholars like the 10th century surgeon al-Zahrawi transformed the field into a meticulous science. His masterwork, al-Tasrif, documented over 50 specific operations and categorized the instruments required for each one. He invented highly specialized tools for every eventuality, ranging from fine blades for bone setting to the first obstetric forceps used to assist in difficult births. These academic blueprints from the Islamic Golden Age provided the technical rigor that eventually saved countless lives across Europe. These complex texts eventually reached the streets of London, where the Company of Barbers and the Guild of Surgeons vied for control over the local medical trade. Practices could be bizarre. A patient with a stomach ailment might receive a boar's bile enema administered through a clyster syringe. Yet they also performed cataract couching, a high-stakes procedure designed to restore sight to the blind. The practitioner inserted a sharp needle directly into the eye's anterior chamber, the space between the cornea and iris. They used it to physically push the opaque cataract lens down into the vitreous cavity at the bottom of the eyeball. This was incredibly dangerous. With no quality control and unsterilized equipment, many procedures were performed by traveling vagrants or even rat catchers. Despite these risks, couching demonstrates a clear, mechanical understanding of anatomy. Practitioners knew exactly what was broken and used physical intervention to fix it. This mechanical mindset leads back to your fractured skull and the most intense operation of the era, trepanation. The surgeon peeled back the scalp and used a specialized drill to remove a circular disc of bone, creating a hole to relieve the pressure of internal bleeding. Modern assumptions suggest that exposing the brain to 8th century air would lead to an immediate fatal infection, but the evidence discovered in medieval graves tells a story that has surprised the archaeological community. Archaeologists in Germany and Italy unearthed 8th century skulls showing clear evidence of full trepanation. The edges of these surgical openings show smooth, extensive bone regrowth. This proves these patients lived for years following the procedure, maintaining incredibly low infection rates. From al-Zahrawi's academic rigor to the sedation of the sleep sponge, these bold pioneers hacked, drilled, and charted the bloody path toward the modern operating room.